Ladies and gentlemen, thank you so much for joining me for this edition of ABJ Live. Today, I have the opportunity to sit down with Dr. Darren Naugles and Lisa Nicole Cloud. You may remember them from Married to Medicine. Now they're working with community leaders, churches, and entertainers to bring free COVID-19 testing to our communities. Today, we're going to cover what we need to know about COVID-19, what's really going on in our communities, and what you need to do to stay safe. Well, first, I would like to commend you for all the work you have been doing in underserved communities all around Georgia. How many people have you guys actually tested so far?
Wow, it's been a lot. Over the last 3 weeks, we've tested more than 5,000 people, and in many instances, we've been giving them 2 tests. So it's been nonstop for the last 3 weeks.
Wow. Now, most of the testing that you guys are doing with people, a lot of this testing is free for them, correct?
Yes, it is free. Through the CARES Act, every person in the country that has access to get a free test done. So we can do uninsured people, we can do Medicare, Medicaid, people who have insurance, first responders, all through the CARES Act.
Wow. Now, you guys recently completed a testing drive with the Ludacris Foundation. How did that go?
It went well. You know, we tested about how many we had.
Couple hundred that we tested. Mm-hmm.
So we performed, I think, about 400 tests that day.
Yeah, and it was really good because that was the first time we really partnered with an influencer from the entertainment industry. And I think it's really important to really get the message out of how important testing is because everybody should know their COVID status to not only protect themselves, but to protect their families and really to protect the community. So that was a really good collaboration, and we look forward to doing more with Ludacris as well as other influencers.
Now, you guys have also been partnering with a lot of the mega churches in a lot of these communities. How has that been going? And who are some of the churches that you guys have been partnering with?
We partnered with a number of churches in the Macon, Georgia area. In Atlanta, the free testing that they did at New Birth, we were a partner on that. Hopewell Baptist Church, Berean Christian Church, Mount Antioch. A number of churches. And I think that's important because in general, sometimes people are leery of testing, especially government testing, even though we're not the government. Let's clarify that we're a private entrepreneur. But because people don't trust testing all the time, when it comes from the church, a trusted source, or it comes from someone in the community that people respect and value their opinions, the turnout is much greater. And so we really enjoyed partnering with the pastors and the churches because there is a real need in minority communities as well as underserved populations to get these resources to them.
And I think one of the reasons why a lot of times people go to their churches because people like going to places that they are familiar with. They're familiar with their church. They're familiar with we've done some at community fields. When they go to these testing sites, they don't know what to expect. You know, they show up to a building or they show up to a site and they don't feel comfortable. They show up to their church, the pastor's there, fellow church members are there, and everybody is, happy and everybody is thankful for being there. So I think, there's the familiarity of a place really secures and helps people feel comfortable.
Mm-hmm. And also the health ministries oftentimes have gotten involved. So now people are being tested by people that they're familiar with also. So right. All of that works hand in hand to get a good turnout in the community to help really get the numbers where they need to be as far as the people that are getting tested.
Now, Darren, you're actually one of our frontline heroes. You're actually in the emergency room. You're seeing these patients. Why does it seem like COVID-19 is affecting minority populations so much more at an alarming rate than others?
Well, if you look at the people who are at risk for serious COVID infections, see, we only really know how many people who are infected who have serious diseases. There's a whole other population of people out there who are asymptomatic. that we haven't even touched or we haven't even started testing. So we really only focused on the sick people. So who are the sick people? Who are the people at risk of serious infections? People with diabetes, people with obesity, people with hypertension, heart disease, kidney disease. And if you look at the rate of rate of these diseases in certain population of people, such as minorities, African Americans, Native Americans, and Hispanics are at the top of the list of the risk or the ratio of people with these diseases. And Caucasians are always at the bottom. We are at the top of every list except for obesity, and Native Americans actually have that. They're the number one minority group that increased rates of obesity. So if you look at it, we're being affected at disproportionate rates because we are sicker and we have more comorbidities or more diseases. So that's why the rates are so alarming in African Americans, because we sit at the top of the bracket in all those diseases that you're going to see people who are in the hospital, intubated, in the ICU.
Was Georgia really ready to reopen?
Well, it's hard to say. One of the things when a outbreak of a communicable disease occurs, and a communicable disease meaning that a disease that's transmitted from person to person, and specifically this virus being a novel virus, a novel meaning that nobody has immunity to it, mass testing should have been initiated way back in February. And if you look at the other countries, developing countries like Germany, Iceland, South Korea, their death rates, their number of cases are down because they tested at a much higher rate than the United States. The United States, we're at the top of the number of cases in the world. We're at the top of the number of deaths in the world. And this spike in unemployment rate really shows that we were really inadequate in the response in the beginning. So how can we know when to actually open up the country and when it's safe to open up the country? And that is predicted by how many people we're testing. We should be testing people on an enormous scale, unlike any other scale. Healthcare officials and public health officials, they predict that we should be testing 75,000 Americans a week, and some even say 20 million a week. We got to get ahead of this pandemic, and the only way that we're going to be able to fight this pandemic successfully is mass testing on an enormous scale. Mm-hmm. So are we ready? Where's the data that support that we're ready? If you look at it, there's only been, I was looking at the news yesterday, there's only been 12 million tests, US tests that have been done on individuals, 12 million. Our population is over 300 million Americans in this country. So we're saying that we've only tested 5%, less than 5% of the American population out there. So how is testing 5% support saying, hey, we tested enough people, we know who has the infection, so we're ready to open? We should at least be up since February, 4 months, we've only tested 5%. We should be up to at least 30% of the American population should have been tested already.
So I think the answer to that is probably not. I know that certain individuals think that we had to open to keep our economy from crashing. But as far as from a testing perspective, no, we have not tested nearly the amount of people that need to be tested to safely reopen.
Well, I started these interviews because of the simple fact we were getting so much conflicting information. We're getting, one thing from the White House, one thing from the governor. We're getting something else from CNN, something else from Fox. What is the real truth versus fiction when it comes to this COVID? Is a mask enough? Is 6 feet apart enough? What is the real truth behind this?
I think the real truth behind this is, since this is a communicable disease, meaning it's spread from one person to the next, that is true. In order for this virus to live, it must jump from one host or one person to the next. If that virus cannot jump from one person to the next, it dies. So the lifetime of this virus is dependent on how many people it can spread. So 6 feet social distancing, some people say you should even be 12 feet social distancing, because they've done studies to where people who have a really hard cough, they're able to expel the virus at a further rate. So 6 feet may not even be enough. Being 10 people in a setting or in a room, that's also some truth. But 10 people in one room isn't going to keep everybody in that room safe. What they're trying to say is that only 10 people in one room, meaning that instead of 10 people being infected, instead of 100 people being infected, there's only 10 people being infected. So I don't know if that makes sense. I mean, the thing is finding those people who are asymptomatic, meaning those people who don't have symptoms, finding them, treating them, isolating them. And social distancing, that's not going to work with the asymptomatic people. The asymptomatic also people who don't have symptoms also need to be isolated, because of the sick people, they're at home, they're sick, they're in their beds. Sick people are in the hospitals, isolated. It's the 50% of people who are infected, who are asymptomatic, don't have any symptoms such as cough, fever, body ache. Those are the ones that are committing the widespread spread of this virus.
And I'll tell you, we've been at sites all across the state. Last week we were in Macon. We were at a church. We took care of everybody that was at that church. So the pastor said, hey, there's another site. Would you consider going there? Because there's thousands of people there. And there's been no COVID testing in this area. So we said, okay. And it happened to be a flea market, right? Now, I was a little apprehensive because I knew people were not going to be trusting in an environment like that. But the numbers were there of people that had not been tested. And that's really what our focus is getting to these underserved populations that have not been tested.
Wow.
Walking around that flea market, I can't tell you how many people were in there with no mask, no gloves, definitely not 6 feet apart in that type of environment, and just completely like, I'm not getting tested, I don't have any symptoms. And I've heard people say online, like when we did the event with the Ludacris Foundation, I heard people commenting, don't get tested if you don't have symptoms. Don't get tested. They're going to inject you with some kind of virus. And all of those are myths that keep minority populations vulnerable.
Wow.
They really do, because everybody should be getting tested, because like Dr. Naugles said, 50% of the people are walking around and they have no symptoms, but they're carrying the virus and they're spreading it to other people. So everybody should know their COVID-19 status. And it's not a situation where you get tested one time. You're going to get tested, and then you're going to get retested, and you're going to get tested again, because that's what is required to really control the spread of this virus.
I think one public official said it best. We should be testing the millions. We should have tested early. We should test late. We should test over and over until this pandemic is over. And that's the phase. That's the phrase that really simplifies continuing to test, repeated tests. And it's going to take a lot of the government. This should be the biggest government-driven task of the century, to get people tested, mobilizing workers and training workers, funding mass amounts of funding to programs such as ours, and also manufacturing resources, getting test kits out there available. Because if it doesn't, we're going to see these surges, we're going to see these rising number of cases every day.
Now, talking about the testing, what are some of the available tests for COVID-19?
So there are a number of tests. The test that we focus on is the nasal swab, which is called a PCR test. And what that's testing for is presence of virus in the upper respiratory tract, okay? It's a real simple test. It takes less than 2 minutes to administer. It can be a little uncomfortable, but it's bearable. I think it looks a lot more painful than it really is, okay? And then we also, and we're one of the only companies doing it at this point, we're doing the antibody testing. And the antibody testing is a serological finger stick test, just like a diabetes test, right? When you check your blood glucose levels. But this one, you stick your finger, we get a little bit of your blood, and then we evaluate whether or not there is presence of antibodies. And we're specifically looking at IgG and IgM antigens.
Antibodies,
sorry. And so that lets people know if they have at some point of time come in contact with the virus and have developed some form of immunity to the virus. It doesn't mean they won't get infected again, but the chance of reinfection where it causes a very complicated case is much lower.
And Americans, we need to know that immunity takes place in two different aspects. One, natural immunity. And this is the one that Lisa talked about. When you're infected with something, your body creates immunity to it. Your body creates antibodies. The second form of immunity is vaccinations. And until we get a vaccination, the only thing that's really going to help us fight this virus is to have our own immunity. And this is actually through contact with the virus, we getting better and our body producing these antibodies for future. And another thing that's really important about people knowing their serological test results or their antibodies or whether they have antibodies is because of the plasma that they can develop or the plasma that they can, the plasma that they can donate has antibodies to where now that plasma can be given to a patient who's really sick in the ICU to help them fight the disease.
Now, a lot of people are saying, you know, you can get tested today. Just because you're negative today does not mean that you're not positive tomorrow. So how often should we be testing people and how often should one person be tested?
You know, that's a good question. And that is a true statement. You can come today and get a nasal swab test and then tomorrow go out and come in contact with someone that has the virus and get it. So I would say as often as people feel that they might have come in contact with the virus.
Right.
If you feel like you came in contact with someone who now tells you that they have tested positive, then you need to go get another test. And I've heard people say, you know, that's not realistic. That means we'll be testing all the time. It is going to become the new norm that you get tested regularly. Just like a person that has diabetes has to stick their finger every single day to manage their glucose levels. I'm not saying you have to go and get an antibody test every single day. Well, actually, the antibody test, once you know you have the antibodies, you don't need to get that test anymore.
Right.
But the nasal swab test, as often as you feel like you've put yourself at risk of coming in contact with the virus, is as often as you need to get tested. And that's why the government has put so many resources that people don't know about out there for testing, because it's not the American population's fault that this virus has created this pandemic, and the government is owning that and taking responsibility for that and providing free testing.
I know I've been tested 3 times.
Wow.
And that's probably not even enough because I'm coming, you know, I still, along with me being out in the field doing these testing drives, I'm also in the emergency department taking care of patients. I mean, I work twice a week in we have a COVID unit in our emergency department where we only see patients who are what we call under the investigation, or patients on PUI. We call them PUI, patient under the investigation. Okay. So I work in those. So I should probably I would probably guess that I should be getting tested like once a week. And I've only been tested 3 times in the last, 12 weeks.
Wow.
But definitely every week since we started really testing. And I just want to kind of put it out there. A lot of people say, well, what qualifies you guys to be out here testing? And so we are, I'm the director of operations of MAJL Diagnostic Laboratories, which is a high complexity national reference laboratory. So we do all kinds of testing, but specifically in this season, there's been a big focus on the COVID-19 testing, and we are CLIA and CAP certified laboratory.
Now, what does average day in the ER look like for you, Dr. Naugles?
My day, it's a 10-hour day. Again, we have 4 different units in our emergency department. We call them 4 different care teams. We have one care team that is specifically for COVID patients, and we kind of rotate through there each day. Those days are a little harder than normal because we have to really fully wear all the gear. We have to wear the goggles, we have to wear the surgical cap, we have to wear the mask, N95, we have to wear the gown. So those days are a little challenging because every time we see a patient, we have to remove everything that it takes about maybe 1 minute to 2 minutes to put on. So, and anywhere in that day, we could see 20 to 30 patients in that unit, in that 10-hour day. The other parts of the emergency department, the other units, they're not the COVID units, so it's a little bit more relaxed, but those days are really intense. It's intense for the nursing staff, it's intense for me, because I'm actually the only doctor in that unit, and for the EMTs. So I salute the nurses, the EMTs, and I really salute the nurses because they spend more time with that patient than the doctor. They're actually in the room for 15, 20 minutes at a period of time, taking care of that patient in that suit that's very hot, that's very uncomfortable. So I commend the nurses. They are truly the heroes of this pandemic, and the paramedics and the EMTs, because they go into these homes, and they go into these homes not even wearing really the proper PPE. They only go in with the mask, and these patients who are coming COVID positive. So we need to get the resources out there to our paramedics, to our frontliners, because we don't want to get them sick, and we don't want to get sick, because we got to take care of not only the COVID patients, but we also got to take care of the non-COVID patients.
Well, I'll pose this question to you. You guys have a very beautiful family, and both of you are working out there on the front lines. Is that scary? You know, coming home, you know, having your kids there with you. What are you guys doing to protect your family?
So that's a very good question. We definitely wear all the necessary PPE when we're out in the field, when we're in a quote unquote hot zone, which is where people are actually administering the test. When we are finished, we decontaminate properly, getting rid of all of the PPE, spraying germicide on our apparel, on our shoes, so that we don't bring the virus back home, coming in, showering really fast, not even walking through the door in the clothes that we had on. So yeah, we do take the necessary precautions. We don't really, you know, our kids aren't around it, but someone's got to do it. And in our community, the mortality rate is much higher. And there's a lot of ignorance about how the virus is spread, who should get tested, why they should get tested. And so our job and our hopes is that we can educate the masses using our influence and also using our expertise, and also just really be a blessing to the community to be able to provide these testing resources.
Yeah, and I would also add in on Lisa when she says practicing washing your hands and social distancing and me wearing the proper PPE at work. But I think I'm going to probably give most of the credit to prayer, just having a strong faith in God and knowing that I'm protected. But still, prayer without action is almost useless. I still got to go out there and practice safety and wear my gear. And, you know, I just can't say God's going to protect me and just walk out without any protection. I still got to perform the action. So, but prayer is important. And just knowing that, just living a healthy lifestyle, eating right, getting the vitamin supplements, so that when I do come in contact with the virus, my immune system is in tip-top shape to where it can fight the virus. Because our immune system at top notch, at 100%, can fight the virus. People don't understand that. You have an immune system at its top 100% or A+ game, you're going to be able to fight the virus. And that's why we have to protect the people who are sick, because their immune systems are not as strong as healthy people.
And I will say that that's important, getting doing things that can build your immune system. My husband shared when we did a couple of lives a couple of weeks ago, you know, vitamin C, vitamin D, what were all the nutritional supplements?
So some of the most important things that will build your immune system, one is sleep, rest. You got to get your sleep and rest. They also said drinking warm fluids would also help build your immune system. the most important vitamin that's going to build your immune system is vitamin D. If you understand, vitamin D is, we only get vitamin D really through sunlight. And if you can see, most people get sick in the winter times. In the wintertime, we avoid the sun. We stay inside. That's why people get sick. So during the wintertime, our vitamin D is at its lowest. But you can do vitamin D supplements. Okay. So you can build your vitamin D levels by going to the store, getting vitamin D, vitamin C, vitamin A, vitamin E. Zinc is a metal that builds your immune. All these things build your immune system. So when you start eating healthy, my analogy is that you're storing for the harvest. You're harvesting your body so that when you come into this pandemic, your vitamin levels are all replenished and you have large storage amounts to where you can fight the virus.
Another thing that I believe in, Dr. Naugles believes in, is the benefits of CBD. Because we know that can also build your immune system and help to fight off inflammation. So we take it, and my children take it to build their immune system. That's not a medical claim or anything like that. That's just what we do as a family personally. And then also, it was something else, going outside, that sunlight, you know, that's important. Get outside and get some fresh sunlight, keeping the necessary social distancing in place.
Exercising builds up immune system.
Oh, and then we have a wellness clinic as well, Dr. Naugles, Elite Medical Associates, and he is doing IV hydration therapy, where if people are deficient in certain vitamins and minerals, he can do a IV drip therapy for you to help you to replenish.
Yeah, we actually have a IV nutritional cocktail, what we call them. And it's basically an immune complex building cocktail, and where we sit and we administer IV, the proper vitamins and minerals and amino acids that you need in order to build your immune system. And the IV usually takes about 30-40 minutes, and we give the IV and we're done. And some people come in weekly, some people come in bi-weekly, meaning every other week, or some people could come in monthly to get their IV infusion therapy. And that's going to be a big thing coming out of this pandemic, is because everything is pushing toward building your immune system and being healthy. And that is probably the most positive thing that we are getting from this pandemic, is that people are realizing that they're probably not as healthy as they think they are. And their immune systems are probably not as in tip-top shape as they think they are. So it's going to be a big push in awareness in this whole immune system building. And I'm all for it.
What is the one thing, just that one thing that you really want people to take away from this interview today?
For me, I want people to understand the importance of getting tested. You know, I think historically people, might be adverse to it, government testing, different experiments, Tuskegee experiment, things of that nature. But this is not about just you. This is about knowing your status, so that if you are one of those individuals who are asymptomatic, that you're not continuing the spread of the virus unknowingly. So just get tested. It's not a painful experience. It's very quick when you actually get up to the line. And know your status. Protect yourself, protect your family, protect your community, so that we can get through this and on to happier, more safe times, and know that everybody can do their part to prevent the spread of the virus. And definitely follow the recommended precautions. Wash your hands frequently, wear a mask, social distance, isolate yourself if you have symptoms. Do your part to stop the spread of the virus.
And that is the most important, what Lisa just said, do your part. And do your part is a selfless act, meaning that just because you aren't sick and just because you aren't healthy doesn't mean that you can just walk around and not protect others. You have to really think outside of yourself and say, I have to protect everybody I come in contact with. If that means that I have to wear a mask, if that means that I have to cover my mouth when I cough, if that means that I have to wash my hands everywhere I go, I have to do a selfless act and protect others too.
At one last question. What point do I need to come to the emergency room, or what point do I need to seek medical advice?
I think you should come to the emergency room, one, if you're sick, if you're not feeling well, meaning if you're short of breath, if you're vomiting and you can't tolerate anything by mouth, meaning that you're trying to drink, you can't drink because you don't want to get dehydrated. If you're feeling very weak to the point to where you're about to pass out. Those are the things. And one, if you have a lot of medical problems and you have a fever, then come to the emergency department.
Now, if someone wants to get tested, how can they get in contact with you? Or if they want to set up a community event or a drive, how can they get in contact with the lab?
So they can always call the lab at 877-272-5008. Again, that's 877-272-5008. There is a site, covidtestkitnow.com, covidtestkitnow.com. We are moving to a place where you can just go there. You can see all the different locations that are online that you can come out to and get tested. That's going to be showing up this week because there's lots of sites on the schedule. And then also pre-registering so that you have an order confirmation when you get there will also make your process even faster. So we just thank you for helping us to really get the word out about the importance of testing, to dispel the myths out there. Nobody's trying to inject anybody with the coronavirus. We're trying to keep it from spreading so that we can get through this safely. And we just want people to know the importance that it is not a disease to take lightly. It is not the common flu. You know, it can have severe impact if you have comorbidity. So be proactive about managing this disease.
Lisa, Darren, thank you so much for spending this time with us and relaying this information to all the ABJ readers and all the people out there. It's been a great interview, great information. And once again, we commend you for all the work that you guys are doing in the community and trying to help raise awareness for us.
Thank you.
Once again, this has been another edition of ABJ Live. I would like to thank Dr. Darren Naugles and Lisa Nicole Cloud for joining us today and giving us all this great information on COVID-19. And here at the Atlanta Business Journal, I will continue to make sure to bring to you firsthand information directly from our community leaders, directly from the people on the front lines, so that we have clear, precise information and not the misconstrued things that we're seeing in the media and in the White House. Thank you once again. I've been your host, Kevin C. Pride, and enjoy your day.